Mpumalanga Health Department has embarked on a malaria awareness campaign. Malaria outbreaks were recently reported in neighbouring countries such as Mozambique, Eswatini and Zimbabwe. However, the Mpumalanga Lowveld region has registered a decline in malaria cases. Malaria is one of the diseases that can be deadly if not detected and treated early. Some of the symptoms include a headache, fever, sweating, body weakness and a loss of appetite. Those who travelled to the three neighbouring countries recently and have symptoms of flu are advised to visit their nearest health facilities for testing. The MEC for Health says although malaria still presents a challenge in the province, the number of cases reported are decreasing. We're joined by Mpumalanga Health MEC Sasekani Manzini. A very good evening to you, MEC. Thank you for your time. I mean, you've spoken about a decrease, but the warnings are heightening in your efforts to raise awareness. What messages are you communicating?
Good evening to you, Mpo, and to the viewers at home. Indeed, we are alert as a province, especially because we are neighbouring your Eswatini and also your Mozambique and also Kruger National Park. So we are registering these numbers so that we can take stock as far as where we as a province. So it's important that we are seeing a decrease, whether it's in terms of new cases. We are seeing a decrease of 59%. Whether it's in terms of the death, we only registered 3. Of course, one life is one too many, but only 3 in the last financial year. And also what is important is that in terms of local transmission, we have registered a 90% reduction, which is only 70 cases. Over and above that, we are not complacent about that. Hence, we work together with our traditional leadership that were part of us, our traditional practitioners, and also our community health care workers that are doing a very good job in the province. So we'll continue to make sure that indeed we alert our communities, we use our churches, also religious leadership was part of our meeting, making sure that we don't leave anyone without being attended to. And what is good is that the door-to-door program that we are doing in the province using our community health care workers, where they're able to even test themselves. If they find you to be positive of malaria, we are able to get a nurse that can come to the house and treat you at the comfort of your home. So we do understand that we should make sure that at all times we work with everyone else and the symptoms are known by the community so that we can not register more than the 3 that we have registered in the last financial year.
So in your efforts to ensure that the numbers do continue to decline, how much of an impact do outbreaks in the neighbouring SADC countries, including, of course, Botswana, Namibia, Zimbabwe, and so forth, add to the threat of cross-border transmission?
It does have an impact. Like the 3 that we have registered is from people that have travelled outside. So it does have an impact in the province. Hence, we are able to also work, include private sector, to be alert at this time. And also in the province, we're not focusing only on the district where it is the one that we are focusing in terms of malaria, but also in other districts, so that each and every health facility in the province, be it private, be it our public facilities, they know our nurses are trained, our doctors are trained. And during this months where we know that we must, of course, look at the history of where you've traveled. So hence I'm saying that it shows that that it's yielding the positive results. Hence the cases that we are registering and our local transmission are decreasing in the province. But of course, you are correct. We must be alert as far as what is happening in the neighboring countries that we are also bordering as a province.
What do you owe your decreases to? I mean, how do you equate the numbers when less and less people are either infected or perhaps seeking treatment earlier? How are you rationing it out?
If you can listen to our program today, the traditional leadership, how they understand it. It means we have invested a lot in terms of making sure that we give them information. If you listen to the traditional practitioners talking, they will tell you that Abokoko in the province, they know, because some of the symptoms are also symptoms that they interpret it in a different way. But because we have invested a lot in terms of the training, hence where we are coming from 2017 to now, it shows that the involvement, you can't work in isolation and you can't discriminate other people. But if we work together and also the awareness campaign in a form of door-to-door that we have introduced also as a province. It is assisting us, and also our sprayers that we have appointed for 3 years, so that the stability and understanding, because previously we used to appoint them every year, and that on its own, the understanding will delay us when you train new people from time to time. So, but in the main is the working together with the key sectors that our people recognize and that are able to spread the positive message. Than because, like for example, the spraying, if you don't work with traditional leadership to assist you for communities to allow you to spray in their houses, if you don't work with local government to allow the people to have an understanding as far as the importance of them allowing people to go and spray. So this collaboration, and also ourselves to taking it to their household as far as also a screening and also treatment, it has assisted us to where we are as a province. And now the 3 being our baseline in the province, it is easy for us to zero rate the death in the province in this financial year.
How are you handling the screening? As we go back to touch on travellers and those entering and moving in the country across the borders, when you look at your prevention measures and the initiation of travellers?
Most of the time, we rely on the people when they come to our facilities and present themselves with those symptoms. So it becomes easy for us because we know that once you come with certain symptoms, then we are able to know the first thing that we need to do is the issue of malaria. And also in terms of whether, even when we are in the province, but now in terms of how we have dealt with malaria in the province, where we have got only 30 incident in the province where people are local, 70, not 30. So it shows that in terms of the education that we are bringing to our people. Remember, in the province, we also take services also to our traditional authorities. So I think the information, and when the people come and present themselves, it might be difficult if maybe in the form of maybe screening everyone who goes in and out of the province. But immediately once they present themselves with those symptoms, that's when we are able to make sure that we detect it earlier.
Very well. Thank you so much for speaking to us this evening. Mpumalanga Health MEC Sasekani Manzini there, expanding about some of the measures they put in place to curb the spread of malaria.